My name is John T. McDevitt. I'm the chief scientist of OralLive. I'm joined by Spencer Price. And this is a very important meeting for us. We're, for the first time, releasing this new technology that I'll talk about today publicly. And we have a booth out in front so you can take a peek at this particular material. So we are working in the space of AI-linked cytology as applied to oral lesion diagnostics. So in the area of oral cavity cancer, we face a particularly big challenge that this area has not improved much in the last 50 years, and during this time, other cancers have advanced. This is typically caught, unfortunately, late stage, where the survivability, 5-year survivability, is less than 60%, and this is one of the most expensive and one of the cancers that has one of the biggest mortality and morbidities. So dentists today and doctors today lack trusted tools in this space, and there are 3 main classes of tools that operate here, the first being the visual and tactile exam, which is very difficult to distinguish between, let's say, a benign lesion and a mild oral epithelial dysplastic lesion. Then there are existing adjuncts that are on the market today, but these are prone to false positives in many cases and lack the trust of the community. These also are, in many cases, by payers considered experimental and have that particular limitation of not creating an incentive to the provider. Finally, we have tissue biopsy, which represents the gold standard in this area, but you certainly don't use that for an early diagnosis. And out of a large clinical study that we ran, we found that the pathologist disagreement for mild oral epithelial dysplasia was 70%. So this is where we want to capture the disease moving forward in the early stages, but we have a problem with an agreement on where this disease exists. So enter now OraLiva. OraLiva is bringing in a 4th class of diagnostic here, new. We consider this outside of the adjunctive space. And this AI cytology focuses on specifically early disease detection and monitoring. So this is a system that empowers dentists and doctors to look at oral biology, and it has strong accuracy, validated in large international studies, 97% accurate. We have approved dental codes, a soft bristle collection modality, and this is available for a variety of different kinds of providers. So the process flow here begins with sample collection, and this is where a dentist or a doctor collects the sample, and at this initial stage there is a cytology brush which rotates on a lesion which is found in a visual and tactile exam. The tip of that brush goes into a test tube. That test tube goes into a kit. That kit is returned to our OralLiva test facility, and then OralLiva bills medical. That particular sample is processed in this blue box. We have AI-linked cytology that identifies the cells, and then we produce a test report which you can think of as basically being a thermometer for cancer. So we take many different parameters, including cytology and risk factors and lesion appearance, and put this in a well-vetted diagnostic model and move that into clinical care. So looking at a roadmap, and you're now witnessing about 10 years of activity here, but we've developed the diagnostic models already, and this gives us an oral cancer numerical index, or OCNI, which has static and reference points so that you know if this patients should be referred on, should they be monitored, or can they be safely monitored in primary care? We are actively pursuing for secondary and tertiary care higher risk patients and to look at recurring cancer and malignant transformations. So we're happy to say that OraLiva last week opened the door, and we're now accepting commercial tests. And in this year, we will expand this above and beyond the oral cavity cancer into benign lesions, including oral lichenoid conditions, about 40 times more prevalent than oral cavity cancer, and also introduce the time course monitoring. Most importantly, we have a vision on the FDA, and we're pushing this to chair side, and this will happen in the next couple of years. Importantly, I want to announce a key relationship with America's largest dental provider. This normally takes 6 to 7 years to happen. We have this in place at launch today. And this is a key step to provide incentive to the various providers. So this test is now available in the Midwest. So we're here for, obviously, for a strategic reason. We have a booth out in front. We welcome you to come pick up a kit if you're interested. And we look forward to talking to you. Thank you so much for your kind attention.